The respiratory medicine practicals are supposed to be held in September first week, I think third or fourth, something like that. And the date has come a week prior. Okay. So you shouldn't be surprised that you get your dates somewhere around 10th to 15th September. Okay. So another day has passed. Probably kal Saturday, everybody will be in the weekend mode. They won't not going to declare anything. So they keep a target in your mind that I am going to prepare, keeping 10th in mind or 15th in mind. Safest bet will be 15th of September, somewhere plus minus 2-3 days. This should be the date. And Baki, these all are speculations only. The ultimate thing will be decided by the declaration by the NB itself. So the main thing is that you shouldn't get demotivated. Your speed, your acceleration, your momentum shouldn't come down. These are the 2 weeks. Push hard, and believe me, you have cleared your theory. That is a very big thing in itself. Okay, very big thing in itself. Don't waste this attempt. Make this attempt your best chance. Okay. Chalo, with this, all these things, let's start with today's session. So today I've made hold of all the topics which I have covered in this thing, so that it will be easier for you to revise. Okay. So we'll be discussing both of them, head and neck and skull base, in 2 parts. First will be today, 20 questions, and next will be on the next session, around 20 to 30 OSCEs on that day. So approximate 50-60 questions are held, and what all extra possible questions can be there, that will also be shared to you. Let's start with today's this thing. This has been asked previously, very important section. So please try to remember important sections of your skull base, important sections of your head and neck. Okay. So I'll try to write the answer of these things. I'll involve you guys also. Please help me out whenever we all feel bored. The first one, that is the A. This thing is your pterygomaxillary fissure. Okay, this is your pterygomaxillary fissure. Please remember it. This is important when you'll study the anatomy of pterygopalatine fossa. All the contents, all the relations will be important to you. So A is your pterygo. This has already been asked once in your exam. Coming to B, B is basically your foramen ovale. There is no fun in telling ki ovale se kya pass karta. We all remember the mnemonic male. Moving ahead, C will be your, this is your C, this will be your carotid artery. D is your incus. E is your facial nerve, which is coming out of your stylomastoid foramen. F is your petroclival synchondrosis. This is the thing which is to be ratified. बाकी चीज आप derive कर सकते हैं. Source of this is Radiopedia. The answers which I have taken. Okay. इसके बाद आगे चलते हैं. This is the answers written over here. Moving ahead. Now, can somebody identify the given condition? The new batch, August wale. Can somebody give it a try? I'll give you a hint. 30-year-old female came to you with, as a case of Seum squamous. You planned her for TM exploration, mastoid exploration, and do a HRCT temporal bone. Now you see this scan. Okay. So are you able to see any anomaly?
High riding jugular bulb.
Great. High riding jugular bulb. So this can be shown to you, and you might be asked what are the gradings of high riding jugular bulb. What all things you should be careful. तो ये तो आपको पता है कि क्या careful रहना है. Middle ear surgeries में you should be aware about this thing. Grading of this thing is divided into 3 grades: 1, 2, and 3. Grade 1, Grade 2, Grade 3. Okay. Grade 1 में that this high riding jugular bulb is located less than 1 mm above the lower border of IAM. Okay. इसमें it is located 1.5 to 3 mm, and इसमें more than 3 mm. So this you have to remember. Second, one take home question जिसको अपने टाइम पे पढ़ना है, dural venous sinus. ठीक है. Which sinus opens into which territory, which vein is formed. ये पूरा डायग्राम एक बार करना है. ठीक है. This is an important potential question. इसके अलावा second will be your cavernous sinus. Anatomy of cavernous sinus. I just saw these things, so I remembered this. Now coming to this. A 24-year-old male came with history of road traffic accident. He complains of watery nasal discharge. You find facial palsy on examination. Identify the condition given in the CT scan below. What is the classification for temporal bone fracture? Okay, so suppose you don't know the first answer. You are a novice, you are seeing it for the first time. तो जब आप second point देखेंगे तो you will come to this point that there is something is related to this thing. Everybody can appreciate this, है ना? Is there anybody who cannot see this thing, है ना? तो ये हो गया temporal bone fracture. Okay, so what all questions extra can be formed in this temporal bone fracture? Let's discuss them. See, these two questions are there. See, this is one. Okay, and this is both images are from Radiopedia. Okay, so initially the classical involvement which we study is this one. Okay, this is called as Ulrich classification. ULRICH. He divided it into, he or she, जो भी थे, into longitudinal or transverse. So one name you should remember this, and the more recent one is by the Kelly and Tammy. This is otic capsule sparing and otic capsule violating fracture. Okay, differences are mentioned. You have to remember these things. Okay, so it shouldn't be missed. Okay. ये हो गया ठीक है. Facial nerve का grading we all remember. House-Brackman grading. Another question which forms is they might ask you give another named grading for facial nerve palsy apart from House-Brackman. So the answer should be Funny-Brooks. ठीक है. So please remember the name itself. Now coming to this thing, this is already asked question. फिर से नए वालों के लिए है. Just give it a try. You are attempting this patient for a mastoid surgery. Now, what you should be aware, क्या दिख रहा है इसमें? बोलो. Corner septum. Okay. So corner septum ये क्या होता है? Persistent petrosquamous suture होता है. ठीक है. So both these things should come hand in hand. Persistent petrosquamous suture, and why is it important? In the mastoid surgeries, you should be aware that this kind of structure can exist. Okay. Coming over here, again, this is a previously asked question. This is the sign. This is called as Kennedy's nipple. Okay. This is called as Kennedy's nipple. Okay. Kennedy's nipple के साथ आपको दो तीन चीजें याद रखनी है. What you have to remember basically. See, this is your anterior lacrimal crest. यहाँ से लेकर के 24 mm पीछे आपका होता है anterior ethmoidal artery. यहाँ से 12 mm behind is your posterior ethmoidal artery, and यहाँ से 6 mm behind will be your optic nerve. ठीक है. So this calculation you should remember, not calculation exactly, the distances which is seen in the course of anterior ethmoidal artery. Second question. Just give me a minute, please. Sorry for the interruption. Okay. So two questions which can extra be formed over here is your course of anterior ethmoidal artery, how it courses inside. One. Second will be your optic nerve के साथ related. There is a classification called as Delano's classification. Okay, so this can come in relation to your sphenoid sinus. Okay, so this data is taken from this Scott Brown table from Scott Brown itself. What important structures will come when you will be approaching your anterior ethmoidal artery. Okay, so after this, please see this video of SPAL. Okay, endoscopic sphenopalatine artery ligation. This can be asked as a video based question. or a GIS based question. I'll share you the link of this videos. You can watch one or two, so that in case something like this is flashed on the screen, you should be ready for that. Okay. See, name of the devil, it's there. The named classification is your Delano's classification. It should be it tells us the relation of optic nerve along with the what its relation with the sphenoid sinus. Okay. So how it goes? Type 1, 2, 3, and 4. This is important. Okay, so please remember it. 1 is adjacent to sphenoid sinus. 2, it's indenting on the sinus. 3rd is traversing through the sinus, and 4th is adjacent to sphenoid and posterior ethmoid sinus. This is an important Viva question as well. Okay, significance of Onodi cell you have seen over here, and you should know how to identify Onodi cell. Onodi cell. One question over here is all the named cells of your PNS. Okay. We have seen Onodi, we have seen Haller, how this agar nasal looks on it. This you should be ready to answer, very likely to get one question in the exam. Okay, now coming to the most important, most overrated, and such a topic from where definitely you will get one question in some form or the other. This is your skull base foramen. Okay, so skull base foramen A to Z सारे याद रखने हैं. Basic anatomy, CT, what contents are passing through it, what syndromes are associated, what other names are there, and apart from that, what are the boundaries? Okay, so this you should be aware. I'll share again the related questions with this. So coming to this particular question, the highlighted structure is your jugular foramen. And we all know that jugular foramen, what all passes through it, it can be jugular foramen is the second largest foramen. Okay, so it is divided into pars nervosa and pars vascularis. Okay, over here the 10th and 11th nerve will be passing. Over here the 9th nerve is mainly passing. Okay, so we should remember that pars nervosa is smaller and it is anteromedial. Okay, so you should remember 9th, 10th, and 11th. Now, what they have asked, what is Wernicke syndrome? Can somebody give it a try? What is Wernicke syndrome?
Involvement of 9, 10, and 11 cranial.
Great. Now, so jo tino nerve, what all these are passing, these things get involved in your this syndrome called as Wernicke syndrome. Apart from that, jugular foramen se 2 syndromes more are associated by the name of Villaret and Collet-Sickert syndrome. We'll be discussing this in the today's PDF also. See, this is again important section showing the important relationships. One will be your carotid canal. See, they have already marked it. Okay, so just go through it. It is important. These type of sections you should keep in your mind. Okay, because वहाँ पे exam में 4 minutes में they will be giving it to you A, B, C, and D. Identify what is B, what structure passes through B, what is this syndrome. So all this you have to answer. So practically you will be having only 30-40 seconds to see and visualize and imagine what's going on. Okay, so this image here we have been seeing it since very long time. Okay, revise it once. This kind of image is a potential question. Okay, this is your jugular foramen's basic line diagram. Okay, now this is the structure in which all the contents are there. Okay, so kindly divide it into anterior cranial fossa, middle cranial fossa, and your posterior cranial fossa. And subsequently, you should ratify it. Okay. So this is a very important question. I'll not say it's important. It is very important section. You will definitely get one question. So please be ready. This is all the things which are basically compressed in a single screenshot. All the structures passing through all your nerves. Okay. Now over here, one question for you will be your GSP. Okay. Please read about greater petrosal nerve. Okay. First nerve which you should read completely in total will be your facial nerve. Apart from that, for OSCEs, you have to read about greater petrosal nerve, median nerve. Okay. Now, coming to this thing, what are the boundaries of superior orbital fissure? We have seen this question, similar question sometimes back. So we know what are the boundaries between them. Okay. What is Rochon-Dubignac syndrome? Okay. So So basically, Roshan-Dubignac syndrome is another name for the superior orbital fissure syndrome. Okay. Now, this is one of the potential question. Okay. Second thing, what they can ask is, what are the contents which are passing through your superior orbital fissure? What are the boundaries of superior orbital fissure? So both the things are mentioned over here. Third question which can be asked is contents. वो आपने बता दिया. Content के अलावा what is the other name? This you know. Fourth question which can come is, what is the difference between superior orbital fissure syndrome and orbital apex syndrome? So the answer goes as that orbital apex में optic nerve is involved, therefore there is blindness associated with this orbital apex syndrome. I'll highlight it. Okay, so please remember this thing. These 4 questions can come from this part. Coming to this 10th question for today, see, over here all the syndromes are clubbed together. We read about this Wernicke syndrome, palsy of the 9th, 10th and 11th cranial nerve. They might even ask you that a person during some sort of surgery, he develops Wernicke syndrome. So what clinical signs will be present? So you should be thinking the other way around also. कि 9th cranial nerve गया, so there will be loss of taste in the posterior 1/3 of the tongue. 10th cranial nerve chala gaya, so there will be vocal paralysis, gag reflex will be gone. 11th nerve is gone, so your shrugging of shoulder and all those things will be affected. So these type of questions can come. Okay, there is one possibility also that identify what is being talked about. So they can give you one image of jugular foramen. They can give you image of this shrugging of shoulder, जिसमें drooping of shoulder हो रहा है, and there is palsy of your 11th cranial nerve, and some associated, and you have to identify the syndrome. That will be your Wernicke syndrome. Okay. So apart from that, these 2 questions can extra be asked. What is Billerud syndrome and what is Collet-Sickert syndrome? So both of them are also associated. Apart from that, this table is from Scott Brown itself. So please read about it. But most important will be this only: Wernicke, Billerud, Collet-Sickert, and उसके बाद आप बाकी जो भी आपको देखने हैं, Evelys, Tapia, Jacobson and Wallenbergs, go through it. Okay. Because one or the other, there will be bouncer question जो people would not have estimated or appreciated that this type of question can be asked. So all these syndromes name are coming in that category only. Okay, so this is an easier question discussed multiple times. Identify the diagnosis, what is the sign, what is the contrast used. This has already been asked. October 23 OSCE session का question है ये. Okay, so diagnosis is your CP angle tumor or vestibular schwannoma. So the diagnosis is your CP angle tumor or vestibular schwannoma. What is the sign called as? So we all know that this is ice cream cone sign. The contrast to this gadolinium 32. Okay, so you should be ready to answer all these 3 questions. Now this again, I'm putting this question again. There are 2 named curves that you should be aware. One is this Nelson-Allen curve of growth of your vestibular schwannoma. Second named curve is your Kaplan-Meier. This we'll be discussing how the question can be asked in the next session, in which we have included around 5 to 8 questions of biostatistics. What all important questions that can be asked. So Kaplan-Meier वहाँ पे देखेंगे. Nelson-Allen curve will be in vestibular schwannoma. Please see this image. Don't forget it. Kaplan-Meier was asked in last session. Possibility of Nelson-Allen curve is there. Okay, let's go ahead. Okay, so भैया yesterday we saw 3 drugs which can be used in your MAP category. All these 3. So this is the 4th one, which is in addition to that. This is your bevacizumab. The importance of this drug is because this drug is used in the medical management of your NF2. Okay. So what is the mechanism of this drug? Can somebody please unmute and tell me?
Anti-PEGA vascular endothelial growth factor.
Great. बहुत ही बढ़िया. ठीक है. Continue this thing. Second thing is, please make one list of your drugs which you have studied. Drugs का ऐसा होता है कि we read, we study, and हमको लगता है कि यार we know this thing. So whenever we get into this confidence कि ये तो हमको आता है, so there is a possibility where we will make a mistake. Okay. So my suggestion will be, if you people are your online type, everything you have made soft copies, So in a WhatsApp message, keep adding all the drugs which you have studied, only with two things. One, mechanism of action should be there, or if something is there, like this is specifically iska inhibitor hai, IgE inhibitor hai, ya kuch bhi hai wo, and third will be your use. So in one line, one drug can be covered. So we have approximately around 25 to 30 drugs which can be asked. Okay. Vertin, Cenarazine, so everybody will be able to answer. Propranolol, steroids, so everybody will be able to answer. These are the fancy drugs which, like, if in case they come in the exam and if we haven't studied about it, so isme ratta nahi maar sakte. Okay, so we have to go about it. Okay, so we all are clear that this diagnosis of this thing is your NF2, and NF2 के साथ ये हो गया. What is the screening protocol for NF2? We all remember this thing. Please remember, this screenshot is from your Scott Brown. That serial MRIs are there, started from the 10 years of age, and screening will be for every 2 years for this one. I'm reading of this line. ठीक है? 2 years for people who are over 20 and every 3 years for people who are 30. Bevacizumab given in your Scott Brown. These drugs जो specifically दिया है Scott में, that you have to remember. Okay? Apart from this, जो कल 3 पढ़ी थी, चौथा map आज का, and fifth map is your cetuximab. Please read about it. We have shared it, I think, twice or thrice. Revise it, add it up to your kitty. Cetuximab is a very important drug. Cetuximab has been asked as a part of long answer question in theory paper also previously. पूछा हुआ है. So this is the importance of cetuximab. Okay, so please read about it. In tomorrow's session, I'll share. Good evening, Dr. Chaitra. Welcome back.
Good evening, sir.
So tomorrow's there are two maps which are used in your medullary carcinoma of thyroid. Specifically used for that drug, for that case only. So I'll share it again. Please go through it. Okay. So these two scans, again, these are repeated images of Scott Brown itself. Please go through it. You might be lucky if you find them in your exam, because these are stat sections, important sections, and likely to be asked. Okay, so you all know that you know the answer how these things have to go across, but like specific sections के हिसाब से you should remember. Okay, initial images which were shared were from the articles, were from Radiopedia journal. This is from Scott Brown. Okay, now study the picture given below, identify the investigation B. I like to reframe the question. 50-year-old reformed smoker came with complaints of dysphagia since last 6 months. On examination, this is the endoscopy finding A and B. Now, what is this image B? Can somebody again give it a try? New people, August wale. Arey doctor, I don't know the answer. NBI, ठीक है? Great, Dr. Akash. है ना? So NBI, जैसे you will speak about NBI, है ना? तो please remember what is this 450 nanometer? Where is it going? Like I'll write it again. NBI 450 nanometer. Lights of the superficial capillary, whereas 540 जो green light है, it goes up till your subepithelial vessels. So please remember it. Over here, two questions to be read apart from this is your stroboscopy 1, Albert law 2, and तीसरा आपका ये हो गया, क्या कहता है, ठीक है, these two things. Please read about it. Okay, in case if you are not able to find any satisfying answer or short type answer नहीं मिलता है, तो do drop me a message, but read about these things. Okay, now again coming to this thing, again this question has been asked. I have seen this twice till now in the previous year papers. That's why I keep on including this question, that this should go into your muscle memory. A 45-year-old female, now see, female with history of smoking, so there should be some important thing related to smoking over here. Okay, so 45-year-old female with history of smoking came with complaints of hoarseness of voice and so. Diagnosis हो गया, grading of the above condition हो गया, and give 2 other names of the condition. Again, please help me out. Again, this should be an easy go. The diagnosis is Rinke's edema. ठीक है? The diagnosis is Rinke's edema. The name of grading for this thing is
Savick grading.
Savick's grading. ठीक है? You all remember it. ठीक है. And now अभी आता है important चीज. What are the two other names of this lesion? So let's see over here. Image is again from your Scott Brown over here. That other term will be so and so: smoker's larynx, pseudomyxoma, pseudomyxomatous laryngitis, polypoid chorditis. जो मर्जी चाहे याद कर लो, 2-3 नाम एक्स्ट्रा याद रखने हैं. You should remember this is one of those questions. Apart from this, inverted papilloma is one another condition जिसमें you should remember your another names. They will ask you what are the two other names of this condition. Please remember. So this is your grading. This is your cervix grading. Okay. See, apart from Rinke's edema, this is very important. There is a distant cousin of Rinke's edema, which is very important, by the name of JORRP, juvenile onset recurrent respiratory papillomatosis. This is again very important. Same. They will give you some history that there is a 8-year-old child of recurrent falana history undergoing this surgery for the second time, fourth time. Okay. So what is the indication? Now over here again same grading will be important. What grading is used, what drugs are used, this is very important. So please go through it. This is a very important question, and same as Rinke's edema, already been asked before and have the chances of again being asked. Okay. So you all are reading perfectly, very good, but keep on diversifying your things. Okay. कि फटाफट पढ़ना है. It shouldn't happen that like Rinke's edema में इससे ज़्यादा time नहीं लगेगा. So how much time we took for Rinke's edema? Hardly 5 minutes. Okay. Same thing goes for RRP. When you study RRP, you should be ready with the important points of RRP, and you should revise the entire chapter of your Scott Brown, oblique your notes, whatever you are studying, in 5 to 10 minutes maximum. Okay. Moving ahead, this is a spotter which can come. This is Ackermann's tumor. Please remember the image. And over here are the table for Botox. Okay, so Botox mein, sorry, my mistake. I should not take the name Botox. Basically, I should take the name of botulinum toxin A, B, C. What are the various preparations of them? So please remember this. This is important. Apart from this, the company और कहाँ पे पूछते हैं आपका cochlear implants में. ठीक है. तो दे विल आस्क यू कि भैया कॉकलियर का जो कॉकलियर का ये है उसका हेडक्वार्टर कहाँ पे है, न्यूक्लियस का हेडक्वार्टर कहाँ पे है. आई विल शेयर यू दैट पीडीएफ इन विच ऑल दीज थिंग्स आर कवर्ड रिलेटेड टू योर कॉकलियर इम्प्लांट हेडक्वार्टर, कि विच कंपनी इज फ्रॉम विच कंट्री. दिस कैन बी आस्क्ड. ओके, ये हो गया ठीक. अच्छा, यूजेस ऑफ बोटॉक्स वी ऑल रिमेंबर. ओके, देयर शुड नॉट बी एनी confusion about the uses of Botox. I'll just enumerate it again. We use in our ENT for spasmodic dysphonia. In our ENT, we use it for spasmodic dysphonia. We use it for Fraze syndrome. We use it for ब्लेफेरोस्पैज्म, टिक्स, स्ट्रैबिस्मस, सर्वाइकल डिस्टोनिया, ऑल द थिंग्स आर यूज्ड. इसमें ये दोनों पढ़ना है. एडेक्टर डिस्फोनिया इज इंपॉर्टेंट. वन, फ्रेज सिंड्रोम. व्हेनेवर दिस वर्ड कम्स इनटू योर माइंड, क्लोज योर माइंड. फ्रेज सिंड्रोम में 3 ऑस्की बनते हैं. फर्स्ट ऑस्की विल बी योर स्टार्च आयोडीन टेस्ट. यू विल सी दैट इमेज ऑफ अ जेंटलमैन ऑन हुज cheek some powder is applied and his cheek is turning some violet, red, brown, some sort of color will be there. So this will be your starch iodide test, which is done for Frey syndrome. 1. Second will be your diagram of your otic ganglion. 2. Third question will be your basic pathophysiology, why this Frey syndrome is occurring, how is this rerouting occurring. And fourth question which can come from this thing is your how will you prevent Frey syndrome. You should be ready to answer all these things. That we will take a thick flap, how you will prevent the nerve, how will you prevent rerouting, and after surgery if it occurs, how we will go. The answer should be your Botox. You Botox de karke we will correct it. Okay. Now again repeated question. Given is the endoscopy, 50-year-old male who is a pipe band player in a music band. So answer is clear by this thing. Answer should be laryngoscele. And what is the Bryce sign? Okay, so we all know what is Bryce sign. When we'll push it, so there will be a hissing sound and these things will go. So remember this Bryce sign, and second sign which will be coming over here, that the name of this sign is voice sign. Okay, so both these are things which are closely related. Please remember them. So we should know what is Killian stasis over here. 3 questions हैं, एक साथ पढ़ लेते हैं. Killian stasis का boundary you should know that the fibers of rhicopharyngeus and fibers of thyropharyngeus form this Killian stasis. from which your this sort of diverticulum can come. Just by image, this is classical. This is the diverticuloscope which is used for this surgery. Okay, and so one more question over here. The question is, you should all anticipate this thing. What is Dollmann's procedure? Okay, so anybody from the August session, take a try. What is Dollmann's procedure?
Endoscopic staplings.
Endoscopic stapling of your diverticulum. We expose it and we basically fix the disease. So Dollmann's procedure हो गया. VDAV diverticuloscope या VDAV laryngoscope is important. Please see the image. Okay. So again, this is a repeated question for you guys. A 16-year-old male came with complaints of so and so. यहाँ पे तो दो चीजें important है. One is 16 years old, and what is the diagnosis? What is Hoagland's criteria? Which antibiotic should be avoided? Now, as soon as you see Hoagland's criteria, which antibiotic should be avoided? See, like if I have to attempt this question in the first choice. So one basic doubt will come in my mind, that why the answer of this thing cannot be a membranous tonsillitis? Why the answer cannot be diphtheria? Okay, so answer can be anything. If you ask DD, so it will start from जो DD of membrane over tonsil होती है, उससे it will start. Okay, but the thing is, the second question which they are asking is, what is Hoagland's criteria? So we all know that Hoagland's criteria is seen in your infectious pneumoniclosis. It is seen in the Kiffing's disease. And we all know that which antibiotic should be avoided. We all know that जो amoxiclav वाला criteria होता है, that should be avoided because it causes some rash over the skin. Third hint which they are giving to you is a young male. Okay, so these are all the things where kissing disease is common. Common तो क्या ही? I have seen around only 2 patients till now. Okay, we are reading it. Just somehow we are reading it, but should be like taking out tricks how to answer this question. Even if you don't know infectious mononucleosis, you don't know the image of this thing, but Hoagland's criteria, antibiotics should coax you up. By the answer of this thing, please don't write tonsillitis. Okay, that is one thing. Second thing, for everybody, there is no negative marking in your OSCE, so please don't leave blank. है ना? आप blank छोड़ दोगे तो examiner won't give you any marks. Please write something, even if you don't know anything. Write something related to that. Okay, so if you are lucky enough, the examiner is considerate enough, even if he gives you half marks 2-3 times here and there, so it will be beneficial to us. Don't leave anything blank unless and until negative marks hota hai. Okay, so this is the 3 questions which not questions, I'll say. This is the associated images of this thing. What are the symptoms of IM? What is this Hoagland's criteria? We all know. And there is a Hoagland sign associated with this thing. This is basically your upper eyelid edema. Okay, ये हो गया, ये हो गया, ये हो गया. Okay, so again, पुराना question, Callan's triad. Okay, so there's no fun in asking what are the 3 points of Callan's triad. I think 5-6 times this OSCE has been repeated. Please don't make mistake in case this image comes in your main exam. Okay. So in this, we should be ready for writing bifid uvula. Second should be your submucous cleft palate, and third should be your translucid zone in your soft palate. Now, as soon as you see this image of a bifid uvula, please remember the image of bifid epiglottis. I'm sorry I was not able to include this in this presenting. Where is bifid epiglottis seen? Which syndrome is associated with it?
Alistair-Hall syndrome.
Alistair-Hall syndrome. ठीक है? Alistair-Hall syndrome. Okay. Coming to this question again, repeated multiple times. A newborn presents with stridor. This is the diagnosis. So what is the most common congenital anomaly of larynx seen in the infants? Laryngomalacia. ठीक है? So sorry, this is the classical finding of laryngomalacia. That is your omega shaped epiglottis. The supraglottis is basically floppy. And what is the diagnosis? You remember it. Management is basically conservative. You have to counsel the patients accordingly. And even if they ask you for what is the surgical management, so you should remember 1 or 2 names. Supraglottopexy is one what I remember. This is what I ratified it. है ना? इसके अलावा कुछ अगर 1-2 और भी होते हैं, please remember one or the other thing apart from this. Okay. So for next session, 2-3 things please read up. Okay, so it will be easy for us. One will be your retropharyngeal abscess. Parapharyngeal we discussed last time. Let us discuss retropharyngeal abscess. Whatever can come in Ludwig's angina. 2. Number 3, you should read about thyroplasty. ठीक है. First thing is type 1. ये याद रखना है, इशिकी's क्लासिफिकेशन याद करना है, एंड कॉफमैन्स फॉर्मूला पता होना चाहिए. ठीक है. So please read these things about Monday, and please see, till now I have been always telling you, relax, be slow. Definitely there is lots of time of left, but now the things are that still DNB has like playing with everything. I don't know why. Okay, so be ready for around 15th, somewhere around 15. You will be lucky that if the date comes and they tell you that 25th का exam है, but you shouldn't be taken aback. You shouldn't be surprised कि एकदम से अभी 1 तारीख को आता है मंडे को कि 10 तारीख को एग्जाम है ना? Because आपका your 1 to 2 days will go in preparing. You would be sitting in Indore and your center will come in Mumbai or say Calcutta or Chennai. Okay, so that is like very toxic situation, I'll say. You have to book your flight or train tickets, you have to book hotel, you reach 1 day prior. So at least 2 to 3 days will go. 1 day for your booking and all this anxiety will take, and 2 days will go because you have to travel, you have to settle yourself over there. So there is not very much time left. So for the new people, I'll be speeding up the OSCEs, the remaining OSCEs which are there. So from my side, we'll target 15th. Okay. In case DNB is good gracious to us that or late hota hai, so we'll have more time for revision. Apart from otherwise, we'll study like this that we have to give our exam on 15th. Okay. कुछ भी doubt रहता है, please get in touch. Okay. Please motivate yourself somehow or the other to study for these 2 weeks. Okay. Everybody has that feeling of give way. Everybody has the feeling of that I don't know anything. Everybody has it. Everybody. Okay. And this feeling will increase as soon as you approach the exam. So just get out of that feeling. Start reading it. Okay. You know the precedences. What is most important. You should go read commerce timely. है ना? It shouldn't happen कि commerce मैं last के लिए छोड़ रहा हूँ, thyroid मैं last के लिए छोड़ रहा हूँ. ठीक है, तो that is very important thing. 1. Second, read your basic topics, है ना? कि what are the important things in otology that you should read, important things in neurology that you should read. Confusion अगर रह रहा है तो I'll keep on sharing topics daily. ठीक है. This is one more good thing that in the morning we can share that today please read around 2-3 topics, and at evening around 9 o'clock when the routine OSCEs are shared, so the basic OSCEs pertaining to that topics will be shared. Like for example of these 3 topics: retropharyngeal abscess, Ludwig's angina, and thyroplasty. Like suppose we say that आज आप ये पढ़ लिए, read something about these things only, and शाम को जो OSCEs will be there, they'll be pertaining to these things only. And revise topics per se. The questions may not be repeated, but topics are definitely gonna be repeated. Definitely 50% questions will be from the same topics. Okay. So let's call it a day, and have dinner. Take good care of yourself. Don't fall sick. Again, I'm repeating. अभी बीमार पड़ गए तो फिर मुश्किल वाला चीज है. So take good care of yourself. Hydrate yourself adequately, and pray to God that dates come accordingly. Chalo, see you guys on Monday with the second part of this session and some other interesting things. Tomorrow's OSCEs will be shared accordingly. Sunday को rest करते हैं थोड़ा सा, ठीक है, and we'll again meet on Monday. चलो, bye, take care, bye.